Hi everyone. Today we're going to be talking about pragmatic language. I'm using a few slides that are adapted from my colleague Dr. Rhiannon Leister at Emerson College. So throughout this presentation, which will be broken up into at least two parts, there are going to be 3 discussion board questions throughout the lecture. I want you to just pick one of these questions to respond to on the discussion board on Canvas. So we're going to start by talking a little bit about the DSM-5. This is the Diagnostic Statistical Manual, and it's in the 5th edition currently. This is the manual that's used to help us diagnose communication impairments in our field. So I'm going to share with you some of the information from the DSM with respect to an autism diagnosis. So specifically, the DSM-5 says that deficits in social emotional reciprocity, ranging from abnormal social approach to reduced sharing of interests to failure to initiate or respond to social interactions, are some of the defining features of autism spectrum disorders. This includes deficits in nonverbal communication used for social interaction, for example, ranging from poorly integrated verbal and nonverbal communication to abnormalities in eye contact, body language, understanding or using gestures, to really a total lack of facial expressions and nonverbal communication in general. We also see deficits developing, maintaining, and understanding relationships. And this can range from difficulties adjusting to different social contexts, to difficulties in sharing and imaginative play and making friends, and may also include a complete absence of interest in developing relationships with peers. So I want you to think about those features from the DSM-5 that are specific to an autism spectrum diagnosis. And I want you to think about the skills that a child needs in order to be successful within a classroom. Your discussion question for discussion question number 1 is which of these symptoms from the DSM-5 would impact a child's classroom success? I want you to think about not just which ones, but how they might impact a child's ability to be successful in the classroom. For this question, I want you to be specific and I want you to give examples. Another thing to note within the DSM-5 is whether or not communication and language are included. So does this mean that language is intact? And if so, what part of language? Phonology, morphosyntax, semantics, pragmatics? What would you expect and why within each of these domains of language? So this visual is to highlight the features of autism spectrum disorder and the fact that a social pragmatic impairment is only one small piece of a diagnosis of autism spectrum disorder. So we think a lot about ASD as a social pragmatic language impairment, but it's really a lot more than that. So here we're looking at a circle. The purple circle is really showing us the component of ASD that is focused on social pragmatic impairment, whereas the blue part really highlights the complexities that go beyond a social pragmatic impairment and that include much more, many more symptoms that impair a child's ability to be successful in their home environment. However, a social pragmatic impairment is the defining feature of autism spectrum disorders. So while it is not the only symptom of ASD, it's the primary and defining feature. But what we might also see is an overlap between ASD and comorbid language impairment. So most of the semester so far, we've been talking about children who have language impairments. And so this red circle that we've added here shows us children who have a language impairment that might be specific to phonology, morphosyntax, or semantics, or any combination of those 3. However, this language impairment is not a defining feature of autism spectrum disorder. So it is not the case that a child with ASD will also have a language impairment. So this visual should be an important one that you remember because the blue circle comprises ASD and the symptoms of autism spectrum disorder. The red circle comprises language impairment. These are 2 different disorders. And so it's really important to keep that in mind because it is often assumed that a child with ASD has a language impairment, but we know that that's not always the case. We're going to talk quickly about some early language foundations. It's not within the scope of this class or today's lecture to go into the details of how language develops and what happens in development for children with ASD, but we are going to talk on a few important points. So first, we see some deficits in precursors to language. So in children who end up with a diagnosis of ASD, we see some very early deficits in prelinguistic skills. And so this includes eye contact, facial expressions, non-word vocalizations, shared affect. In typical development, we see these things develop in the first months of life, and those are necessary precursors to developing speech and language. So in children who end up with a diagnosis of ASD, we see deficits as early as in infancy, in that first and second year of life. So before the child turns 1, we may see some deficits in this area. We often see a deficit here in first words. And so as you know, first words should develop by at least 1 year old, sometimes within a range of 12 to 18 months, but it is almost always the first red flag that parents note with respect to a pragmatic language deficit associated with ASD. So this kind of language delay is common, but you may not see this in every child with ASD. Because as we know, language impairment and ASD are 2 separate diagnoses. So we'll talk a little bit more in a few minutes about unconventional language. And so what you'll notice is that as language emerges in this population of children, we see an increase in unconventional language use. And so their first words are quite unusual. I'm going to give you a few examples of these in the second part of this lecture. One thing that you may also hear discussed with respect to autism spectrum disorders is a loss of language or a regression. And so in general, this does not happen to the majority of children with autism spectrum disorders. So we do typically see, for most kids, an improvement in language throughout childhood. However, about a quarter of children with an ASD diagnosis experience a loss of language between about 16 to 24 months. So you may see some language start to emerge and then a regression in those skills over time. It's really at this point, the association between that and the child's outcomes are really unclear. That is to say, the association between losing language in development and your outcomes for later language use as a person with ASD is still not well known. So what's important here is that we might see some differences in receptive versus expressive knowledge. So we see a receptive language delay that can be really helpful in determining whether or not a child has autism spectrum disorder compared to other disorders. And we may also see a difference in how receptive versus expressive language develops for children with ASD compared to their typically developing peers. So for instance, we know that in typical development, there's an advantage for receptive language over expressive language. So we see receptive language developing more rapidly and is typically stronger than expressive language for typically developing kids. That's not always true for children who end up with a diagnosis of ASD, and the results of that are really unclear at this point. So I'm going to pause here, and this is going to be part 1 of our lecture, and I'm going to come back and record a second part that you'll listen to as well. Thank you.